So, I have a little bit of breaking news for you guys. I saw this report coming out earlier today, and so I wanted to talk about it here. The White House is now considering winding down its coronavirus task force in weeks to come. Let me read a little piece of it, then we're going to talk about it. So, it is not clear whether or not any group would replace the task force, but its gradual demise, which officials suggest might never be formally announced, would only intensify questions about whether or not the administration is adequately organized to address the complex life or death decisions related to the virus and give adequate voice to scientists, etc. The New York Times report spoke to Vice President Mike Pence, who has helped oversee the task force, acknowledged that the administration was having conversations about winding it down. Now, the obvious sort of context of that debate going on in the White House is the broader debate which we've been having as a country, which is how do we actually balance the health and well-being of our economy with the health and well-being of our most vulnerable, including our elderly and those with various kind of autoimmune deficiencies, etc., etc. And the White House actions is taking on increasing scrutiny because it's being done in the context of the fact that a number of coronavirus prediction models are now beginning to uptick again. So initially what was going on is that a lot of the models were increasingly going down. So, initially at the beginning of this thing, people were saying that 1.5, maybe even 2 million people might die from this thing. But then over time, we saw the models continually decrease. Now we're starting to see the models go back up and the predictions of how many people are going to die. So one of the very prominent coronavirus models, which is oftentimes cited by the White House, is now projecting 134,000 coronavirus deaths, which is nearly double of its previous estimate. We also saw this. An internal Trump administration report now expects 200,000 new cases daily by June. So we're starting to see a lot of these models begin to uptick. Now, part of the reason, of course, is that we're starting to see states reopen. We're starting to see Georgia reopen. We're starting to see Texas reopen. We're seeing parts of Florida even begin to reopen, as well as, especially the beaches and aspects of Florida. And also we're starting to see people going to the beaches again in California. And that's certainly a very, very big factor of it. Although if you look at it by state, which we're going to look at a little bit in just a minute, it also simply has to do with the fact that people are abiding by social distancing much less strictly. In fact, if you actually go into the numbers of that particular, the 134,000 one, that is related to it, is that when you make models, when you make predictions, you are making a guess, making an estimate ideally based on, relevant or, data that you're looking at of how many people are going to be abiding by things such as social distancing. And we're starting to see people getting a little bit sick of this stuff. People getting a little bit sick of staying in their home and quarantining, and they're going out more often. They're getting together with friends, et cetera, et cetera. And that is leading to a situation where the virus is more able to spread. Now, I do want to talk a little bit here. Nate Silver has a bit of a response here because a number of people, as you might imagine, are getting really confused when they see these models, see these numbers changing around. We saw, for instance, Lieutenant Governor of Texas saying that we had the wrong data, we had the wrong science, we had the wrong information, and he was basing that claim on the fact that the models were changing. So Nate Silver is responding to this quote here, this quote in this article here, talking about how the model keeps changing, or the fact that the model keeps changing is evidence of its lack of reliability as a predictive tool. Now, Nate Silver responding to this, and this was a good response from Nate Silver here. He says, there are some good critiques of this model, but in my opinion, this line bothered me. The model outputs should change based on responses to new data. When you're dealing with nonlinear systems, small changes can have reasonably large effects. So as I was saying there, when we look at situations where people are no longer abiding by social distancing, and the sort of percentage of people abiding by social distancing can go in vast swings as people get new information from the president, from various leaders and representatives, and then suddenly, okay, let me start social distancing again, et cetera, et cetera. These kinds of things lead to vast swings in the data, and so there isn't really a clear way to predict or to know, because a lot of these things are just black swans, right? Something dramatic can happen in the news, and then suddenly one area of the country starts social distancing significantly more. And these sorts of things you can't really predict, you can't really know. And so the models, what they do is they do their best job to try to figure out and get an average estimate of how many people are going to be abiding by social distancing, how many people are going to be wearing masks, how many people are going to be frequently washing their hands, and then they make these guesses. And the fact that the models change is not evidence that the models are not useful, that they're not helpful, and most certainly is not not evidence that we should just ignore the models. That's not true. That's not accurate. But one of the major political dimensions which we're seeing in this thing is that blue states are being hit significantly more. And especially what's more interesting that we're seeing right now, and we're going to get to this in just a second, which is that blue states, for the most part, are beginning to go past their curve, whereas red states are starting to see the start of the peak to their curve. So I'm going to show you guys that, but first take a look at this here. You can see this is taking a look at the cases in the New York metro area compared to the rest of the country. You can see here in the New York metro area, they're past their curve. They're going back down. Now, it's possible that if they reopened up suddenly that it would, respike, etc. But what we're seeing here is that here in the United States, you might expect that because of the fact that, the New York City had the vast majority of cases, that the fact that it's declining would mean that the United States cases are dropping, but not quite. It is slowing down a little bit, you can see here, but it's still going up, which is very suggestive and does, significantly show you the fact that other areas are beginning to peak. So if you actually take a look here, this is the broader map of the country itself. But if you take a look here at the states which are, sort of behind their curve here, you can see where new cases are decreasing. You can see basically they're all Democratic states with exceptions. So for instance, there's South Dakota, Arkansas, Montana. So there's a few red states mixed into here, but almost all of these states which are, past their curve and the numbers are decreasing are Democratic states. So they already saw their peak. Whereas if you go over here to the states where the numbers are beginning to increase, it's a mix, but we are seeing a lot more Republican states, at least compared to the numbers of states which were decreasing. You see Iowa, North Carolina, which is, more of a purple state, but Missouri, Wisconsin, Minnesota, more of a purple state, Nebraska, Kansas, and I mean, other areas, Democratic areas are starting to see their peak. For instance, Washington, D.C., I live in Northern Virginia, and so, that area is starting to see a peak. But you can see basically the areas with high population densities, the city areas, are also the areas which have the highest cases per capita. And so, which obviously and very understandable. But that led to a situation where early on, a lot of the states which, got particularly badly hit were Democratic states. And it's actually not just states, it's actually internal to the states as well. So just zooming in on my home state of Virginia, you can see here the rural areas of Virginia. Virginia is a great example state because Virginia, it has both very rural areas and very urban areas. So the very rural areas, hardly any cases. I mean, this county here had 6 cases and 0 deaths. I mean, so very, a lot of the rural areas, hardly any impact, but a lot of the urban areas getting hit pretty hard. So Charlottesville getting a little bit more, Richmond getting a little bit more, but especially in Northern Virginia and DC, sort of where I live, you can see here basically all the cases in the entire state are here in Fairfax County. So that's just a great example of how even internal to the states in question, the Republican areas are being hit less hard. And that leads to a sort of calculus among those elected officials where, especially on the national level, where they're like, hold on, why did I shut down my economy? I'm going to get, the majority of people are going to be voting against me because of the impact, the economic impact, not because of the coronavirus impact. And so that obviously, leads to a situation where their very political incentive is literally just to ignore the scientist, right? Because they're concerned about their own reelection. They're just concerned about their own reelection. And so it's not a particularly good or enviable situation to be in. It's not going over particularly well. And the other thing that I do just want to quickly mention here is, I put out this tweet here, which basically, the thing that we've been seeing from a lot of Democrats is a kind of scolding, especially a lot of the more liberal Democrats, not the, sort of leftists. I think the leftists have done a much better job at handling this, but a lot of liberals have been mostly scolding people about social distancing. So I just want to tell you kind of what I mean by this. So over the past few weeks, not only have we seen liberals talking down to Tara Reade, but they've also spent the majority of their energy lecturing and scolding people on social distancing without providing or hardly even suggesting any serious economic remedy for the people's struggles. So I introduced, at the beginning of this video, I was mentioning how, we're having a debate about how we balance the concerns of the economy with the concerns of, the health of our, the least of these, the health of our elderly and the health of those with various kind of autoimmune deficiencies. Well, it seems like the solution, which a lot of sort of more centrist Democrats have come to, is basically, oh, well, we just have to engage in social distancing, and we're not going to be doing enough to actually help the average worker, help the average person, or et cetera, et cetera. And so it just amounts to a bunch of scolding, and that really is also leading to it's not just material impacts, is what I'm trying to say, right? Like I was, laying out the sort of material situations, which is leading to Republicans being more willing to, abandon the coronavirus economic shutdown. But there's also a bit of an ideal. Ideas are also entering into the picture here, which is that a lot of Republicans are feeling quite resentful at the way that Democrats are scolding them, in a sense, with social distancing, where a lot of Democrats are looking down at Republicans for the fact that a lot of people are just like, look, why'd we shut down our economy when we hardly had any people die? And Democrats just say, well, look, you've just got to shut down the economy, listen to the scientists, et cetera, et cetera. And not really providing any kind of serious economic relief for those workers who are really, really struggling, because a lot of people got really, really hurt. We're looking at tens and tens of millions of people unemployed. And so, I think that some of it is starting to, I think that that also explains some of it. Now, I want to talk a little bit here because I think that we can find a balance, because Matt Stoller put out this tweet it's kind of responding to this New York Times article, which basically, this article just talks about how people are beginning to be, concerned about the moral worthiness of who gets bailouts. And Matt Stoller, in this sort of tweet thread here, makes a really, really good point, which is that we need to be looking at a national investment authority. What does that mean? We need to be looking at taking public stake of certain corporations and certain companies if they're going to be getting bailout money. We can't just be giving out bailout money, willy-nilly to everybody who needs it. Because it is true, look, some companies deserve it more than others. But look, it is the case where, if we're spending money on you, we get a say in the things that you're doing. And you might be like, that's crazy, that's unprecedented. It's not. In the 2008 bailouts, in the 2008-2009 not coronavirus, in the 2008-2009 Great Recession, that was at least the talk. Barack Obama and John McCain were talking about doing this. Did they push for it? Did they actually do it? No, but they were talking about it. Why were they talking about it on the campaign trail? Because it's popular, because people support this idea. Now, again, they didn't actually push for it. They didn't actually do it, but they were talking about it because they knew that those ideas are popular. They are politically feasible. And also, by the way, we have a lot of other precedents. For instance, the first national bank with Alexander Hamilton, literally the beginning of this country, they did that, right? The first and second national banks took a lot of partial ownership in a number of companies and sort of grew them up, tendered them, et cetera, to grow the way that the country wanted them to grow. And so we actually have a lot of experience with this as a country. We've done this a lot in the past. More recently, though, a lot of politicians like to hide behind sort of financial obscurity, like, oh, look, it'd be so difficult, blah, 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 to really just obscure the fact that they're not willing to actually take any kind of serious political stance to, guide a company, because if the company actually makes a bad mistake, then those political actors are at fault, and then their seats might, are sort of at risk. So they would rather just bail out the company and then not have any actual responsibility. So it's a sad situation that we're in right now. But the point I'm trying to make is this. We have a lot more options available to us than just, oh, how do we balance the coronavirus response with balancing the economy? We can possibly do both. It's going to be difficult, and it takes a lot of brave political actions. It's going to take politicians being willing to risk their seats, risk their career, and stand up for moral principles of, just saying, look, this is wrong or this is right. It takes people being willing to stand up for the values that they run on, the values that they claim to believe in. That's what it's going to take if we want to actually conquer this thing. We have the resources, we just need the guts to use them. That's what this comes down to. That's what this coronavirus response really comes down to, in my mind. Now, obviously, look, someone's going to have to sacrifice. That's inevitable. Someone, somewhere, somehow is going to need to sacrifice. The question, though, is whether or not we let the most vulnerable suffer, or whether or not we ask the rich to pitch in their fair share and help us all out during a time of crisis. So anyway, I just want to give you my 2 cents on some of this stuff. If you like the video, I'd appreciate it if you hit the like button and consider subscribing. Thanks.